Good morning. I'm going to give it just a moment. So good to have you all here this morning. Jacob, how's the waiting room looking? Does it seem like we have most everybody in?
Yeah, I'll keep admitting, but so far so good. Go ahead
All
and
right,
get going.
awesome. Hello, everybody. Welcome to this week's morning meeting with Groundwork Ohio. If you are like me, you have your third or fourth cup of coffee in your morning meeting mug. It is great to see you all here. And we have a really excellent guest with us this morning. And as usual, I'll just kind of kick off with a few updates. Starting first on the federal front, we actually have some positive news there. As Congress did pass that legislation, bipartisan legislation, the appropriations last week that did include funding for a lot of key child and family serving programs. So it is notable that lawmakers on both sides of the aisle voted to continue and in some places expand investments that support maternal and child health, early learning, and economic supports for families. So we're thrilled to see that. And we currently have a thank you campaign in response to that funding going through. That thank you campaign is active now, but it is closing tomorrow. So, really, the goal for this is to show appreciation to Ohio's congressional delegation that voted yes on this legislation. So, if you're able to take 30 quick seconds to participate, please click on that action alert that my colleague just dropped in the chat because that positive reinforcement really does make a difference. So we invite you to do that. And stateside here in Ohio, we are seeing some movement on a number of bills that are affecting young kids and families. Starting to get some first hearings on several, and there have been several press conferences lately as well. So kids and families are really in the conversation right now at the State House. I will flag one just for y'all's awareness. That was House Bill 464, and it does have a companion bill in the Senate, which is Senate Bill 218. So these bills would exempt certain military certified childcare providers from Ohio's specific licensure requirements. So really, this just means that providers that are certified through the Department of Defense could operate without going through an additional licensing process at the state level. So that is one that we're watching and one that you can look into on your end again as well. Those bill numbers once more, House Bill 464 and companion bill, Senate Bill 218. We are keeping track of all of this and will continue to share updates as things evolve and change. And now I'm thrilled to pivot and to welcome our fantastic guest, who is an amazing maternal and infant health advocate in Ohio, Ms. Bianca Holder. So, Bianca is the maternal and infant health manager at March of Dimes. She leads programs and partnerships that advance health equity and improve outcomes for moms and babies. Her role focuses on addressing disparities in maternal and infant health by implementing evidence-based initiatives, fostering collaborations with hospitals, community health centers, managed care plans, and advocating for access to quality care. Bianca has been an advocate for the maternal and infant health space for over 10 years. She's dedicated to dismantling systemic barriers that negatively impact pregnant women and children's well-being. She holds a Bachelor of Science in Public Health from Kent State and a Master's in Public Health with a maternal and infant health concentration from the University of Minnesota. So before I turn it over to Bianca, as always, please know that you are welcome to drop your questions in the chat anytime, and we will reserve some time at the end for Q&A as well. So now I will officially turn it over to you, Bianca. Thanks so much for being here.
Share my screen here. Does everyone see the March of Dimes screen
Yes.
now? Okay. It officially says that you all can see it now. Great. Well, good morning, everyone. Thank you so much for joining today. I'm super excited to be presenting on our 2025 March of Dimes report card. Every year, March of Dimes releases a report card on our prematurity rates all across the nation and in Ohio. And so I'm excited to just show you the different aspects of the report card. And there's a couple of new things this past year that was released, including insurance types when it comes to healthcare. And so I'm excited to kind of dive into that as well. So before I officially begin, March of Dimes has been around for over 80 years. And with this decades long of just being part of the communities, I wanted to just share this just because I believe March of Dimes has impacted most of us. And so I would actually be very curious once I finish reading all these, if you want to write in the chat one of these numbers, 1 through 4, if this is something that you have experienced, then you are a part of March of Dimes. So number 1, if you or someone you love received the polio vaccine, you've been impacted by March of Dimes. March of Dimes funded the research to help make it possible. If you know a child who survived premature birth, you've seen the impact of March of Dimes' decades of investment in neonatal care and research. If you or someone close to you received prenatal care, education, or support during pregnancy, that system has been shaped by research and advocacy supported by March of Dimes. And if a family you know had access to folic acid education that helps prevent birth defects, that's part of the March of Dimes legacy as well. So if you have experienced one of these things, I would love to see, or if you know someone who has experienced these things, it would just be so awesome to see to see the impacts that March of Dimes has had on all of you. That's awesome. 1 through 3. Wow. So some of you guys have, seen this. That's amazing. Well, thanks for sharing, everyone. So I'm going to stop sharing my screen. Caitlin is going to share a quick video.
Right. Let me make sure I get this shuffle right, y'all. All right, here we go. And I will make it full screen real quick before I hit play.
I was screened at birth for illness and disease.
I received the polio vaccine.
My preterm baby was able to breathe on her own.
I had paid family leave after I gave birth.
I am March of Dimes.
Since 1938, March of Dimes has never given up on improving the health of families.
You may not know it, but every single one of us has been supported by March of Dimes.
Even if you're healthy today.
You are March of Dimes.
Today, we're facing a serious challenge.
This nation is one of the most dangerous for childbirth.
Why?
Health inequity.
March of Dimes is working towards improving the health of every mom and baby through education, research, and advocacy.
I have been supporting and raising money for March of Dimes for 28 years. But the fact that March of Dimes has saved the life of my son, I feel that it's my opportunity to share my story to help others and to help further this mission.
Where every family has equal access to care.
Shamani passed away 13 days after we gave birth to our child. I'm sharing my story because we understand that the numbers are horrific. We know the statistics, but when you're able to connect numbers to real people, it changes the game.
Where every baby born too soon has the chance to survive.
I was born at 35 weeks. Just because it happens a lot doesn't mean it's supposed to be normal. It might not be the most extreme of stories, but they have to be educated, and that's why we're with the March of Dimes, so we can spread awareness.
Where every mom, pregnant and postpartum, is heard.
In postpartum, all of my eclampsia symptoms were dismissed, and I almost died twice. I'm sharing my story today so other women feel empowered to advocate for themselves and to advocate for others as part of this community.
No matter your background, your gender, race, or where you live.
This is our anthem.
This is our anthem.
This is our anthem.
This is our anthem.
Resilience.
Health equity.
Community.
Fortaleza.
Access to care.
I am March of Dimes because March of Dimes is family. March of Dimes is community. March of Dimes are people, individuals who understand that they have a role to play in this world, to move the agenda forward.
With your help, your time.
With your voice.
We can.
We can.
We can make change happen.
We are March of Dimes.
And so are you.
Thanks for that, Bianca. I'll turn it back over to you if you have more slides to share.
Yes. All right. Yeah, so I wanted to just share that video just when we think about data and when we think about just when we're going to see all the data, all the information and everything. I just want to make it a point to just keep people at the forefront of these stories, that when we see numbers and data, a lot of times it can be so easy to forget the individual stories that are impacted. So I just wanted to share that. Do you all see my screen? Yes. Okay, great. So I'm gonna. Yeah. Okay, so our mission is simple. March of Dimes leads the fight for the health of all moms and babies. And our vision is we imagine a world in which every baby is born healthy, regardless of wealth, race, or geography. Our organization has two main goals. One is to end preventable maternal health risks and death, and the other one is to end preventable preterm birth and infant death. And this is all under the umbrella to end the health equity gap that's happening in our nation. So where a mom lives could determine if her baby is born preterm, which is pretty insane when you really think about this. So according to the 2025 report card, the preterm birth grade in as like the US as a whole was a D plus, which means half of the US states received a D or an F. So as you can see, Ohio is in that orangey yellow category. We have PA that did a little bit better than us. Michigan and Indiana were in that D range as well. And then West Virginia and Kentucky, they were in that F range for preterm birth. And when we say preterm birth, that means any baby born before 37 weeks. And so more states saw preterm birth worsen than improve in the past year, according to the report card. 19 states improved, 21 states worsened, and then 12 states there was no change at all. So this is a very big graph, but as you can see, when you look in that F range in the red, you can see Cleveland being at a 15.6% for preterm birth and Toledo being at a 13.9%. So we are in like the bottom part of 1/3 of the Ohio US cities have received an F. And so that is something definitely to think about. I live in Cleveland, and every time this report comes out, I'm always so shocked because we have so many hospitals in Cleveland. You would think the preterm birth grade would look different, but these are the facts that we're seeing. So when it comes to Ohio, the preterm birth rate in Ohio was an 11%, which is actually higher than the rate in 2023. Last year, we received a D plus, and this year we received a D. And so we have increased our preterm birth rate this past year. So the data below illustrates the differences in preterm birth rates by race and ethnicity and by insurance types. And as you can see, Pacific Islander and Black individuals, they had the highest preterm birth rates in Ohio. And as you can see as well, Medicaid patients were the ones who had the top preterm birth rates in Ohio as well. So you might be thinking, what are the causes of preterm birth? Why? What's going on? And so some of these are just conditions that people are more likely to have when it comes to preterm birth. So that includes 6.4% was due to smoking, 5.3% is due to hypertension, 37.1% is unhealthy weight, 1.6% diabetes, and 13.6% is hypertension in pregnancy. So when it comes to the infant mortality rate, the rate decreased in the last decade. In 2023, 909 babies died before their first birthday in Ohio. And so as you can see with the ranking, Ohio is ranked 48. So the infant mortality rate among babies born to Black moms is 1.9 times the state rate. This rate is so alarming. I mean, the fact that it is double the rate of any other ethnicity is such a huge deal. Some of the leading causes of infant death include birth defects, preterm birth, which is something we advocate really highly for at March of Dimes, sudden infant death syndrome, and then accidents. The rate of inadequate prenatal care among babies born to Pacific Islander moms is 3.6 times the state rate. As you can see, when it comes to inadequate prenatal care and also first trimester initiation of prenatal care is very high. You can see the difference between the national rate, which is 16.1% versus the Ohio rate, which is 14.7%. And the measures below are important indicators for the health of pregnant and postpartum women in Ohio. So Ohio received a 26.5% for low-risk cesarean birth. 93.4% of hospital deliveries had severe maternal morbidity, and 25.4% of births had maternal mortality. And so this is something that is just so tragic when it comes to the death of moms specifically, and something we need to keep at the forefront of our minds as well as we really think through the statistics and the rates in Ohio. So Ohio has adopted a few policies, and some of them Groundworks has been a leading cause of, and including Medicaid extension, Medicaid expansion, doula reimbursement just happened in the last 2 years. And then we also have a maternal mortality review. Something we are definitely fighting for on a legislative level is to have paid family leave, and also to have and offer mental health services to screen for postpartum depression during well child visits. And so that is something that I know we are definitely pushing for on an advocacy level, but we would love to see all across the board. We want to see those green check marks in Ohio. So at March of Dimes, we have several different approaches to this preterm birth rate crisis in Ohio. One of them includes data analysis, like this report card. We do research, public policy, and consumer education. We also do a lot of public awareness campaigns and advocacy. And then we also do health programs and professional training. So I'm going to just show you a few different things that we offer, and maybe you guys would be able to be a part or use this in your organization as well. So one of them is that we have various health action sheets, and these are all free, that you can give out to your clients, give out to your patients when it comes to pain killers, when it comes to preeclampsia, signs and symptoms, navigating postpartum stage. We offer a lot of free resources for mom and baby, as well as to have on a clinical setting with doctors. We also have a low dose big benefits campaign where really this campaign started about 2 years ago, and we would love to see low dose aspirin become a nationwide, just a normal thing that we are offering to our moms, because this helps with preeclampsia, it helps with high blood pressure, and also it is known to help with preterm birth as well. So there's a little QR code if you want to learn more. There are free resources as well that you could use for your patients. We also offer a free educational class. There's a QR code at the bottom for this low dose big benefits campaign. And this is just a great way to receive professional education credits, but also for anyone who would like to learn more about the benefits of low dose big benefits. That's something that we are offering currently. And 2 more slides here. I know Groundworks has an awesome advocacy network. March of Dimes also has one as well. You'll receive a couple emails a year on what's happening on a national level and then as well as a local level. So if you would love to stay involved in what's happening through March of Dimes and what we're doing on advocacy level, feel free to click on the QR code and it'll sign you up for just updates on what's happening on both the state and local level. And lastly, I would love to invite you all to March for Change. All the data that I have shown you today is really hard sometimes to digest when it comes to just the rates and the fact that we haven't improved since last year on our preterm birth grades. But this is an opportunity to join us at the Ohio State House on March 24th. I'm super excited this year, actually, because we're going to be partnering with Birthing Beautiful Communities and during World Doula Week, where we're going to advocate for Senate Bill 267 to establish Ohio Doula Awareness Week. And we'll also have a couple other bills we're currently watching, as you all are as well, to support healthy mom and babies, improve research, and increase access. So please register. We would love to have you there. I know a few of you guys already have registered, but we're super excited to be advocating for moms and babies this year. Any questions? Thank you, everyone.
Thanks, Bianca. That was fantastic. So much good data and information. And I want to thank participants that have been engaging in the chat and some personal stories popping up there. So thank you so much for that. If there are folks that do have questions, I'll give you some space, a moment to type, or feel free to come off mute. I stay ready with questions too if nobody's got anything. Well, Bianca, I was wondering, it really stood out to me when you were sharing the information and statistics around postpartum depression, and it reminds me of in Groundwork's 2025 Early Childhood Data Dashboard. It's the most recent dashboard we have. I just always find this one particular statistic so staggering that 41.6%, so less than half of women with a live birth who are diagnosed with postpartum depression received counseling during that year. That's reported in our 2025 dashboard. And I'm just curious, from your perspective and your experience, what you think the factors are that lead to that disparity between diagnosis and treatment, especially when we're thinking about mental health for moms.
Yeah, that's a great question. I think, especially when it comes to Black moms too, there's been a lot of data out there. I think it's about 40% of women of color in general are just not having access to mental health services. I think a lot of it could be stigma, where they feel like they can just do it and push through, because a lot of it could be, previous generations have done it, so why even get the services now? And then also a lot of it could just be that they're not getting asked the right questions. There is I know there was a study that came out where they talked about how many times does a doctor actually ask questions when it comes to maternal mental health. And I know that there's been some, I believe, the organization that I'm trying to think of, it keeps slipping my mind, but they did just a pilot on this where they were able to have during the 6-week checkup, they were able to have questions for the moms when it comes to postpartum checkups. And there was a dramatic increase in the amount of women that actually received counseling and services. So I definitely think that it's out there. I just don't know if it's at the forefront of people's minds when it comes to mental health services.
Thanks for that, Bianca. Appreciate it. And I'm curious too, I feel like we always ask this question, but have to as an advocacy organization. I'm curious if there's any specific bills that you all are watching on the March of Dimes side, or anything that you would promote to our audience, have them go look up and follow and watch along.
Yeah, I actually do have some. Let's see, I have some notes. We are currently looking at House Bill 537. It's for midwifery and birthing centers, which would expand the birth workforce and access care. And it would be directly tied to maternal mortality prevention and rural access. So that's definitely something we're looking at right now. Another one is House Bill 245 for parenting and pregnancy services. I know the funds would provide direct services for pregnant women and infants, and then also address basic needs, counseling, and care coordination. So those are two that we're looking at, and we're still trying to follow along, but hopefully during March for Change, we'll have a couple more bills that we're able to advocate for as well.
That's great. Thanks, Bianca. And if you have not had the privilege of attending the March for Change event at the State House, I've been able to participate a couple years running, and it's really a fantastic advocacy day and a fantastic event. You always do such a great job. So thank you, Bianca, for all the hard work that I know goes into putting together a really strong advocacy day. Any other questions or thoughts from the audience? If there's nothing from the crowd, I see Brittany her video just popped open. Good morning, Brittany. I know you had something you wanted to chat about real quick at the end of the half hour as well.
Thanks so much, Caitlin, and thank you, Bianca. I apologize I wasn't here at the very beginning. I'm starting an braces journey with my fourth grader, and it ran a little late, so I did get to catch the presentation, and I'm super excited about the Advocacy Day on March 24th. So thank you for being here. It's always good to see you. I just wanted to put a quick plug in for anyone who's tracking the state capital budget, because the timelines were just released last week and a half, and it's a really quick turnaround. The worksheets are due to the House and Senate by March 12th. Our capital budget happens in the years where our operating budget isn't happening. It's largely for public entities like universities and major kind of publicly funded spaces, but there are community projects as well. So I will put out in our newsletter, but I also wanted to pop in the chat the state guidance on the capital budget here. And share that timeline is March 12th to submit the worksheets to the House and Senate finance chairs. So sometimes they have different worksheets in the House and the Senate. This is the project that the worksheet that the legislators will use to champion the projects in their district. So if you are pursuing a state capital budget item, you need to get that into your legislator ASAP. And I would work with both House and Senate delegation. There does have to be a nexus to the state. So this is not like the state operating budget where there are earmarks. There are a lot more restrictions around this funding, how it can be used, and there has to be this nexus to the state where there's a state entity like a university that will be a component of the administration of the funds upon implementation. So if anybody has offline questions about that, I don't want to get too wonky. Please feel free to shoot us an email. But I did want to just pop on because the turnaround is quick. We have less than a month to get those together. And my chat's not loading. It says there's a new one, but it's not loading. So is there a question, Caitlin?
There
Okay.
is not. It's a note of appreciation.
Oh,
and
sorry.
I'll continue. No, that's okay. I'll continue to extend that. A huge thank you to everyone who was here to listen to Bianca's presentation today. And another huge thank you to Bianca for being here and sharing your work, but also to March of Dimes for the fantastic things that you're doing for Ohio's moms and babies every day. Appreciate everyone's time this morning, and I will wish you a very happy Thursday. Take care, everybody.